your lymphatic system. It's not just about lymphedema. We could all benefit from a functioning lymphatic system because it's the very system that encompasses our immune system. And so what chronic disease process or acute process doesn't have to do with the immune system? There's not any. They all have to do with the immune system. So it is definitely a foundational therapy in my practice and the practices that I work with worldwide.
Yeah. Jennifer, thanks so much for joining the show.
Thank you. Thank you. Glad to be here.
So why don't you tell us a little bit about yourself, your background, and what you do?
All right. Well, my background is I'm kind of retired from mainstream medicine as a nurse. I worked in cardiology, oncology, and internal medicine. And, my journey transitioned with the diagnosis of non-Hodgkin's lymphoma for my father. And of course, we did chemo and radiation, and that's all I knew to do at that point. Very young in my career. It destroyed his heart. They gave him less than, 2 months to live. And so I was devastated. Working in the field of oncology, I didn't think there were any other alternatives. And so fortunately for me, I was very blessed to have a director that knew all about what we called back then alternative medicine. Today we call functional medicine. And he steered me in the right direction with introducing me to a man who had cured himself of a brain tumor, and that changed my direction. And I went back to school and became a naturopathic doctor after my father survived the 2 months. And the tumors, shrunk half their size. And 6 months, a year later, he was pronounced cancer-free. And still working in the same field while going to school, it was hard to swallow. And so eventually I went full into functional medicine and started working with cancer patients that way, helping them to change their diet, their lifestyle. Later found the importance of mind-body connection. And that, I noticed that with some of the patients that would not heal. They had very deep trauma, and I didn't feel like I was qualified at that point in time to help them through that trauma. But they would, they'd get a little bit better, and then we would hit a wall. And so I went back to school to become a psychologist because I wanted to be able to, help them walk that journey as well. Meantime, I started seeing a lot of lymphedema patients and didn't know what to do with that either because, in my field prior to that in oncology, we remove lymph nodes, we radiate the body, we cause most of the lymphedema cases. And I didn't know, I knew very little. We had about a chapter in nursing school about the lymphatic system. And so it's very elementary, my background with that, until I went back to school and became a lymphedema specialist. And that's when, my direction shifted again. And that's why I specialize in the immune system. So as a naturopathic doctor now and a lymphedema specialist, I help people to rebuild their immune system, to support their immune system, to heal their body using the lymphatic system.
Yeah, I love that you're talking about emotional trauma and dealing with that. And I so resonate with that. I just think so many underlying health conditions are the result of emotional trauma. And that's why I'm talking about it more and more and more on the show, and doing my own personal work with emotional trauma and transmuting and releasing that. It's such important work, especially if you feel like you keep hitting a wall. So tell us about lymphedema. So what are the symptoms of that? When should, how does someone figure out if they have lymphedema?
Right. And it's really going to be up to the client to figure that out, unfortunately. Because if you wait to the point that a physician finally figures it out, you're going to be in one of the later stages. And so I was actually speaking a few years ago in Mexico City to a group of physicians, medical doctors about lymphatic health and lymphedema. And I asked the audience, I said, how many of you know how to properly diagnose? And I had one doctor in a group of 400 that knew or felt comfortable diagnosing that and then knowing what to do for that. And so, the first thing, if you've had radiation and you've had surgery, whether it's to remove lymph nodes or just, abdominal surgery, if you start to notice that you're beginning to swell and your skin is getting tight and thick and uncomfortable, that is the early signs of lymphedema. Now, as it progresses, you can do what is called the stimmer sign. So the affected area, you can press with your finger, your thumb, and if it leaves the indentation, that is a sign that the lymphatic fluid has turned to a very congested state like butter, and your lymph is blocked, as we talked about earlier. So, that would be considered more of a stage 2. And then when you get to stage 4, it's elephantitis, it's fibrotic, it's hard. And unfortunately, in mainstream medicine, all we have is manual massage and bandaging and compression. And that's what I'm trained to do as well, but I don't do that because most of my clients back then when I got certified, they were not compliant. They didn't want to come into my office and let me massage them for, hours and wrap them up in bandages and leave there. And most times the bandages would fall off and they would try to rewrap and they would cause more damage than before. And so it didn't work for me, for the bulk of the clients that I was dealing with lymphedema. And that's one reason I started searching for an instrument, a tool that I could use to get the same effects or better without them having to come into my office. And that's why I had the XP2 lymphatic drainage device developed for that particular group of patients that I was seeing. But then I found out that, your lymphatic system is not just about lymphedema. We could all benefit from a functioning lymphatic system because it's the very system that encompasses our immune system. And so what chronic disease process or acute process doesn't have to do with the immune system? There's not any. They all have to do with the immune system. So it is definitely a foundational therapy in my practice and the practices that I work with worldwide.
Yeah, and then the lymphatic system carries the toxins out of your body as well. It's one of the roots, and so we got to keep that. One of
the main routes, for most definitely. And that's what most people know about the lymphatic system is, that's my detox system. But it's also the system that bathes every cell in the body with nutrients. And so you see a lot of people and a lot of practitioners like myself, scratching our heads wondering, why are all of these obese people so malnourished? And it's because they have a blocked, congested lymphatic system, and they're not eating the foods that feed those systems, and it's not being carried to the vital organs and glands. And so that's the first thing I noticed it, and I didn't notice it until I started working with autistic children who are extremely malnourished because of the dysbiosis in the gut, the gluten sensitivity, the inflammation. And I started using lymphatic therapy with them with their supplement regimen and got absorption. I was able to, in most cases, bring their supplement load down to less than 50% and get better absorption, better, response with them. And so that was remarkable because, some of the protocols for autism is so extensive. I had parents bringing suitcases full of supplements into my office and, just really struggling, trying to get their children to ingest all of that and still not getting good absorption. And so was able to reduce it drastically.
That's fantastic. Yeah, because it's not what you supplement with or eat, it's what you absorb that counts. Yeah. And so how does the lymphatic system get blocked in the first place? How do people develop lymphedema and the other issues related to, their, blocked lymph flow?
Right. So typically it will begin with just inactivity. Your lymphatic system doesn't have an automatic pump like the circulatory system. So it requires movement, exercise. And so many people have such a sedentary lifestyle that starts, the congestion. And so most Americans have a degree of congestion in their lymphatic system. Then when your hormones, when you're stressed out and you start secreting cortisol and things like that, that creates inflammation, all the dysbiosis, the glyphosate that we have exposures to that causes the leaky gut, and then all of those toxins start leaking out into the blood, that blood and lymph, that creates congestion. And so there's a lot of different things. And it's, we're just bombarded with toxicity. And then what really amazed me was that emotional component. I can have a person who is raw vegan, does 12 to 15 servings, which I recommend, of fruits and vegetables a day. They do everything right, but they have extreme stress. Within seconds of them being in a stressful situation, their lymphatic fluid goes from a watery consistency to like cottage cheese. And you can feel it when you do the assisted lymphatic therapy, and you can see it if you do thermography. You can see it in a live blood cell analysis. And so that showed me the power of the emotions and the stress. And I mean, most of us have chronic stress, not just acute. Acute stress is good, keeps us safe, and we respond. But chronic stress is what most of us are dealing with day after day after day, and we wonder why we have all this inflammation throughout our body, and that's one of the main reasons. And that's why I feel it's so important. I believe that every disease process, the underlying issue is emotional trauma.
Yeah, I firmly believe that too now as well. Mm-hmm. And so are there some simple tips, things that people can do at home to facilitate lymphatic flow?
Yeah, there are some things, and movement is one of them. So exercise, and it doesn't have to be really strenuous because different people respond to exercise differently. So if you're like a type A blood, you typically do well with yoga and low impact exercise. Type O, they like strenuous exercise. And so, rebounding 10 minutes on a mini trampoline twice a day is great to do. We really need to start teaching our children to do that. I see more and more childhood illnesses. I mean, just in the last few weeks, I've had just a slew of children age 15, 14, struggling with dysbiosis, lymphatic issues, brain fog, autism, ADHD, depression, suicidal thoughts. And it's a big, big problem. And you cannot be healthy in your mind when your body is toxic. And if if you have all of this stress and things that are unresolved, then your body's going to be in a state of inflammation. So it's this vicious cycle, and people don't know really how to deal with that. So exercise for one, juicing for another. Juicing helps to feed the body the nutrients in a way that's very absorbable. And so it kind of bypasses the dysbiosis issue while we're trying to heal the gut. And they get the critical nutrients that their body needs to function properly. And then, if you have more like a stage 3 or stage 4, then that's when you really need to see an assisted lymphatic therapist and get a deeper, cleanse with something like the XP2, which is an inert gas ionization device.
Yeah, let's talk about that for a minute. That's really interesting. And I'm really happy. I do exercise 5 days a week, and I'm doing juicing every day. So juicing for the win. Yeah. So I definitely checking those boxes off. But so tell us about the assisted lymphatic therapy and what that entails and kind of results that you've seen with that.
Right. So, the assisted lymphatic therapy deals with not just the superficial lymph, which is mainly what manual lymphatic drainage deals with. And the superficial lymph is important. 70% of your lymphatic system is superficial. It's right underneath the skin. But that 30% is in the gut. And we really can't get to that well manually. And so that's where the assisted lymphatic therapy comes in, because that's where 70 to 80% of your immune system lies. So if you are dealing with any kind of chronic disease process, you're going to have to be able to reach where their immune system is in the lymphatic system and direct the immune system. And so that's what we do with the XP2. So I don't know if you can see this really well, but these are cases like lymphedema. So this is the before picture of her arm. And this is a mastectomy where she had 10 lymph nodes removed. And you can see the swelling is 2 to 3 times bigger than her other arm would be. This is just after treatment. Now, manually, that's very difficult to do, and you would have to do day after day of manual massage, wrapping, and then put them in compression. This is done with the XP2, 1 to 2 treatments a week for an hour, no compression, no bandaging. Same thing up here. Congestive heart failure patient had swelling in the ankles, able to get it down drastically. So you can see that those more complicated cases can be treated very effectively, and patients, the main thing is patients are compliant. It is kind of like getting a full body massage, because we do it with a full body approach. And I mean, we do the central nervous system, we do the full front of the body and the back of the body to stimulate superficial and deep lymphatic function. And so the types of conditions that can be benefited from that can be anything from chronic fatigue syndrome, neuropathy, fibromyalgia, any inflammatory issue. I've worked on patients with glaucoma, macular degeneration. We're doing it, of course, for lymphedema, but non-Hodgkin's lymphoma. Had a case where he had tumors the size of oranges under his arms and like a soccer ball in his abdomen. He had congestive heart failure, and his story is quite amazing. He went in and, through the mainstream initially first. They couldn't do anything. They gave him just a short amount of time to live. He was young, in his early 50s, I believe. And after just about 6 months of therapy, we were able to help repair his heart and get him off of being listed as congestive heart failure. We were able to reduce the size of the tumor. He's now thriving, and he actually has his own podcast that he shares his story and his journey and his walk with me in his recovery. And so you see things like that all the time, people. But, he's one of the first men to really deal with the physical issue, of course, the dietary changes. He followed everything to a T. But the most beautiful thing was that he was willing to address the emotional trauma. And he had a lot of emotional trauma that was surrounded with his church and some of the community, and felt very betrayed. And that's where he believes that his cancer just kind of progressed, and he was brokenhearted, and that causes the heart condition, but alive and well and thriving to this very day.
Yeah, I love that. I love to hear stories like that, and people, having awareness and taking responsibility for their emotional trauma. It's so easy to fall into that trap. I think if you have a physical issue, it must be only a physical solution.
Right.
When there's so much more.
Never.
Yeah, so much more to it than that.
Well, that's what people's got to realize, is that you have these symptoms for a reason. Your symptoms lead you to figuring out the puzzle pieces of what's going on in your body. So pay close attention to your symptoms. Just like I had a cancer patient who had brain cancer and, had struggled with making decisions in their life, or struggled with feeling threatened and didn't want to deal with the emotional component. And so your body creates things in it to save you, to protect you, to bring you to an awareness that you will do something about it. So when you don't deal with your emotional trauma, it's downloaded into the body and it causes stagnation. And you can see that through testing. You can see where it causes the stagnation. And that's where many times, cancer will progress, or heart disease or diabetes. All of that has to do emotionally. Heart disease has a lot to do with brokenheartedness. Diabetes is loss of sweetness of life, and sometimes discussed. Lymphedema is feeling stuck and devalued, and I have to protect myself. So a lot of times patients will develop lymphedema if they've been attacked, especially bilateral lymphedema in the legs. And I had that lady here with the arm. Her emotional issue was that she always felt like she had to be ready for a fight. And she was always attacked by her family, attacked by her ex-husband. So she developed lymphedema in the arm that she was always trying to defend herself with, which I found was, very interesting, because she actually had a total mastectomy and all the lymph nodes removed, or a large number, in both arms. So you would think it would happen in both, but no, it just happened in the one. And so it's very amazing how the brain and the body work together. And we really have to retrain our brains and our body to work together that in a way that benefits us. And the only way that can happen if you listen to the messages your body's trying to give you.
Yeah, and it's interesting. I think also people that have weight gain, or they think something is weight gain, it can actually be lymphedema and swelling, especially people that are, doing a lot of different things right. They're eating a good diet, they're exercising, they're doing everything right, and they just have, their body is swollen a little bit. It could be edema.
Right, could be. And many times they'll go to the doctor and they'll say, you know what, I just have all this thickness in my leg and hips. And, they'll say, oh, you just need to lose weight. And when it's a lymphatic issue, it's not about, obesity and weight gain from the things that you eat, just like you said. It's your lymphatic system is not draining. And so the fluid will accumulate. And you'll see that a lot. And sometimes it's not even lymphedema, it's lipedema. And that is inflammation in the adipose tissue. And that type of lymphatic disorder causes you to have a lot of pain and discomfort. So many people, think that they have nerve damage or something like that. So there are so many lymphatic disorders that people are not aware of, and we need to become aware of. And you can never go wrong by stimulating and supporting your lymphatic system.
And so do you train practitioners in this? Do you just do this at your clinic, or are there other practitioners that have been trained?
Right. So no, I train all over the world. And so my program, the university, is really about training qualified, practitioners to do lymphatic therapy for a vast amount of different conditions. And so we have it in about 17 cancer clinics over in Asia, several here in the US. A lot of physical therapists now do it because that's typically who does lymphedema type treatments. We have massage therapists doing it. We have clients learning how to do it for themselves. So if they have Lyme disease or they have lymphedema and they're going to need the therapy for the rest of their life, it's better for them just to learn how to do it themselves. So, and now all the training is virtual. And so we're able to do, the A&P online along with the hands-on training for certification. So we do all the certification worldwide.
Oh, that's amazing. So anyone listening here, they can get trained in doing this lymphatic, assisted lymphatic therapy?
Correct.
Amazing. Yeah. And so where does the role of lymphatic drainage massage? Because that obviously seems like it'd be very helpful, but obviously there's more advanced strategies, but if someone is listening and they're concerned about their lymph, can they get lymphatic drainage massage?
Oh, most definitely. And there's lymphatic drainage massage therapists, and there's PTs and PTAs all over the country that will do that for you. And so, like I said, it addresses 70% of the lymphatic system, the superficial lymphatic system. So you're going to get benefit from it. It's just with those chronic cases. But when you do assisted lymphatic therapy, it's really the same technique as manual, just using the assistance of an inert gas ionization so you can go deeper into the body. We can get the lymph in the central nervous system. We can get the lymph in the gut activated. So, it's very similar. So we have a lot of manually trained lymphatic therapists or lymphedema specialists that are now learning the assisted therapy and using that in their practice because it saves them time, and they don't have to do necessarily have to do the compression or the bandaging. So It's a win-win for everyone.
And so you said that the assisted lymphatic therapy is using inert gas ionization. Can you explain that a little bit more and kind of what that treatment looks like?
So it's using a device that has argon, krypton, and xenon gases. And, since the 70s, we've been using this type of technology for lymphatic conditions, for acne and things like that, and sinusitis and things like that. So those gases actually decongest the lymph. And so manually, when you are doing lymphatic therapy, you're moving congested lymph from one area to another by manually pressing against the skin in the body. Assisted lymphatic therapy dissolves that congestion, turns it back to that watery state. So it turns it from that butter, cottage cheese, or fibrotic tissue back to that watery tissue that can flow easily through the collectors, because these collectors can be the largest lymphatic vessel in the body is like a string of yarn. And then most of the collectors in the body are like a few strands of hair. So you can imagine trying to push butter through a few strands of hair. It's very difficult. And that's why people get congested. They swell. And, sometimes they notice it, sometimes they don't. They typically will notice it more when it's in an extremity, but many times it's in the core and they don't notice it. They just think that they're gaining weight or, retaining fluid, and to some degree they would be.
So that's fantastic. Yeah, because I've had a habit since I was a teenager. I actually went to 2 different massage schools when I was 19 to learn all about lymphatic drainage and a therapeutic massage. And so I've had a lifelong habit of getting at least once a month, getting a deep tissue massage, but they end up doing, the lymphatic drainage, a version of that during that type of massage. And I love Korean spas. They do like the best massage ever on the planet. They know what they're doing there. So that's
they certainly do. Yeah.
Yes. Unfortunately, they don't have that in Mexico, which I miss so much. But I'm sure I can find one somewhere. Sure. But anyway, so why don't you tell the listeners where they can work with you, where they can learn more about your work and about your training?
Well, my main office is right here in Atlanta, Georgia, but I work with practitioners in, many cities across the U.S. and then over in Asia. And so you can work directly with me here in Atlanta. You can work indirectly with me with one of my other practitioners. And then I have a team here too, or I have 2 other practitioners that work with me that are trained in lymphatic therapy. They are certified in the advanced level. They teach it. We have instructors all over. And like I said, now because of COVID, it's 100% online. And so you can do training anywhere. And we have trainings monthly. So all you need to do is just reach out to our office at Right Way Health and Wellness. And, we can connect you with someone close to you who works directly with me, or we can work directly with you if you are in our area.
Fantastic. And what is your website again?
It is rightwayhealthandwellness.com.
Fantastic. And what other therapies do you do there at your clinic?
Well, so because my specialty is the immune system, and I see all types of clients. I see cancer, Lyme, any kind of, heart disease, diabetes, all of that. I do a number of things. We do biofeedback testing using the Zyto technology. I do and review labs for optimal levels. So many times clients will go into the doctor, have labs drawn, and then everything looks like it's within range and they think they're okay, and they leave there 6 months later, they go back, doctor says, oh, well, now you have diabetes. Well, if you look at the optimal levels of those numbers, which are a smaller range, you can actually see where you're trending towards diabetes before you ever develop it, or heart disease. You can see if you're dealing with bacteria by looking at the neutrophils, or viruses by looking at the lymphocytes. So your blood does tell you a lot if you know what you're looking for. So I help to teach clients how to look and read their own labs so that they can prevent these trends from happening. And then we do EVOX therapy for the emotional, retraining the brain. I do some of Annie Hopper's work as well for the brain retraining, recall healing. Dr. Michelle Schrader is a dear friend of mine. We've worked together now for years. And years ago, we worked on her grandson, Case, who had a brain tumor. So I helped her to figure out what was going on with him and found the tumor. And then her and I worked together doing EVOX and helping him to resolve the emotional conflict behind him. He's thriving today with no reoccurrence. It
Amazing.
Can be done. Yeah.
Amazing. Yeah, I actually just did an EVOX cyto scan with Dr. Michael Rankin Sr. And it was so unbelievable. I was crying and he was crying, and it was just so amazing. And the Zytoscan, it's a bioenergetic scan. It's a bioenergetic feedback scan. It's a similar to Nest Health, but I think it's much more detailed. And then you have a very, very also detailed emotional trauma component with the EVOX scan, which is the Zytoscan, but it's the emotional trauma scan.
Right. And it's a therapy too. So it's a scan and a therapy, and, it gives you a ton of information. So you take, the EVOX and the Zyto, you look at the labs. I do heart rate variability and BIA as well. And that's information that's drawn from that can give you a very detailed picture of the health of the individual. And mind, body, spirit all shows up with those types of testing. And so it's very helpful, because I just got off the phone right before this interview with a client who she was in tears. And she's like, I've been searching, and this doctors just tell me if I don't do this, I'm going to die. And, they put that trauma on them. And she said, but I don't feel, called to do that. I don't feel that poisoning my body is the right thing to do. And I just want someone to help me, support me, monitor me. And I see that day in and day out, where patients are just so frustrated with our medical model, and they just need that personalized attention and to feel like there's hope for them, and give them back the control. It's no longer, the doctor being the God and dictating everything that they do, but stepping back down to the role of teacher, and let me teach you, some tools, or give you some tools that you can use to empower yourself to be the healthiest as you can be. And that requires dealing with the physical and the mental and spiritual.
Yeah, it's really very upsetting to me when I hear a doctor saying, oh, you have 6 months to live, or there's nothing more that we can do, or it's time to go home to
That's
prepare.
The God mentality. Mm-hmm.
Yeah, and it's there's always something that you can do. And the doctor is just speaking from his frame of reference and his limited toolkit. That he's told that he can or can't have. So I think people need to be aware of who they're speaking to when they're being told things like that.
Yeah, and you need to go in to your doctor works for you, and you need to interview them. You need to know what their foundational beliefs are and understand where they're coming from, and realize that, they are not God. They do not know if you are going to live 6 months. Dr. Cowden shared a story at one of the conferences where a lady who was diagnosed with a terminal illness, she was an older lady, her children didn't want her to know. Doctors said, just take her home. There's nothing we can do for her. She would probably live a month. And so they took her home and they just loved on her, and she just loved having all the attention, and, she was happy, and she lived like 12, 15 years, and they were giving her like a 90th birthday party or something like that. And they're laughing and they're like, Mom, did you know you remember when you went to the hospital back so-and-so, time? She's like, yeah, the doctors told us that you are not going to survive, because of your illness. They said you would die in a month. And did you know that as soon as they told her that, because she had such high expectations for doctors, she died a month from that day. Her children shared that with her, after years of just, living. And that's the power of the mind. And that's something that fascinates me. My mother, who died at age 59, when she was younger, had run into a lady who was a palm reader at a company, dinner. And she was just so kind and didn't want to hurt the lady's feelings. So she said, let me look at your palm. And she told her, oh, well, you're not going to live, until you'll die before you're 60. I mean, who tells people that anyway?
Yeah.
And my mother, she consciously knew that was, she couldn't know that those things. But she, every so many years, she would make a comment about that. And did you know she died a month before she turned 60? And I do believe that things like that get lodged in our subconscious mind. There's a lot of belief patterns that we have that are not good for us, and that are lies. It's not truthful, but when we buy into them, there is a physical action in the body that occurs that leads to, and that's where you see the mind-body connection. I love Dr. Michelle Stridham and her approach. I don't know if you're familiar with her. She's an oncologist that is now calling out doctors and saying, we really have to look at the emotional component to disease. We have the science to show us what physically happens in the body and what does that mean, for that person. And so she actually goes in and breaks it down very nicely for you and just really challenges physicians to be very careful with their words and, putting that negativity on their patient instead of inspiring hope.
Yeah, exactly. Because, like Dr. Bruce Lipton, his book, The Biology of Belief, at your words, your thoughts, and that your physical body follows those instructions. Mm-hmm. And so you have to be very careful and responsible in how you speak to yourself and speak to other people as well. And my father had the same thing. He died from his cancer treatments, and he was told by his oncologist that he had less than 6 months to live. And lo and behold, he died within 6 months, almost, within that 6 month mark. And I do believe it was what the physician told him, and he really didn't try or really do anything to try to get better besides what the doctor told him, because he believed he only had 6 months, and so I think it patterns people's behavior and their expectations, and they kind of give up.
Mm-hmm. Right. And that's so true. And then I've been doing this for 25 years now, and I can tell you just from the experience, the patients who have strong belief and will not buy into the diagnosis that they are given are the ones that are healed and don't have a recurrence. And so, the ones that just kind of go through the motions, but they don't really believe that the therapies are going to benefit them. They've given up. They don't value themselves. They don't believe that they deserve to heal. They don't heal. It doesn't matter what you do. And so, giving people back the tools, because we can talk about how, if you believe that you're going to do well, but they don't even know how to get back to that point of belief. And so that's where these modalities like the EVOX and emotion code that Dr. Bradley Nelson does. And,
yeah, brilliant,
you know,
brilliant.
yeah, Caroline Leaf and Annie Hopper and all of these are amazing tools that you can learn yourself to use to heal your body and heal your family and your friends. And, you know, so I encourage people to educate themselves on these, to become their own doctor, become their own medical detective. And, you know, practitioners like myself and Dr. Rankin, we're only here to kind of help guide you in our expertise, but really you have to become your own doctor, your own medical detective.
And you have to do the work. You have to do the work yourself. No one's going to do it for you.
No, that's true.
Yeah, it's a full-time job, let me tell you. Well, Dr. Grammith, thanks so much for coming on the show. Just such a pleasure. Everyone loves talking about lymph on our channel and on this podcast.
Awesome.
It's a very popular topic. So thank you so much for coming on. And again, tell us where we can learn more about your work and work with you.
Yeah, that's definitely. Again, you just can go to our website at Right Way Health and Wellness or contact our office directly. And we'll be glad to, we do a 15-minute consult with anyone that's been on your show, that heard us on your show. Just let them mention to the staff that they heard you or heard me on your show, and we'll give them a 15-minute consult if they have questions about a particular case. I'll be happy to do that. I encourage you too to share with your audience on the juice fasting, because you can really purge your lymph. If you do a 30-day juice fast, typically by day 14, you have totally cleaned out the entire lymphatic system. And so whether it's a 21 or a 30-day, I typically do 30-day juice fast once or twice a year to clean every system of the body. And that will cut down on, the supplement loads that you have to take and things like that. So it's a great lifestyle tool to have to incorporate. And you don't have to start out with a big 30-day. You can gradually start, but when you get to day 14 to 16 is when you're really cleaning the lymphatic system, boosting your immune system. And, those of your audience that are really concerned about their immune system right now with all the press and things like that on the viruses out there, I encourage you, the best thing that you can do for your body is to build your immune system so that your immune system, which is what fights off any pathogen in the body, can do its job properly.
Yeah, fantastic. Well, thank you for mentioning that. I like that tip on the juice fasting. That's great.
Awesome.
One day, I'm going to do a long-term juice fast. Hasn't happened yet.
Right.
But I do love juice, but with food. I just eat it with food. Jennifer, thanks so much for coming on the show. And everyone, thank you so much for tuning in every week. It's such a pleasure for me to help educate you on how you can be your own best advocate for your health and empower you with the knowledge of all the experts we have on the show every week. So thanks for tuning in, and I will talk to you guys next week.
The Myers Detox Podcast is created and hosted by Wendy Myers. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Wendy Myers and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.